For non-binary patients, seeking healthcare can be a painful task. When 19-year-old Cam Brooks was admitted to a behavioral health care facility in Sanford, Florida, after having suicidal thoughts, a nurse following her usual procedure asked the teen to remove personal items, including a bra. "It's a chest binder, not a bra," Brooks, who identifies as neither male nor female but as gender non-binary, responded before changing into a long-sleeve shirt and gray sweatpants. During another interaction at the same facility, Aspire Health Partners, a non-profit that caters to low-income patients, a counselor asked if Brooks was male or female. This question, Brooks lamented, ignored the possibility that someone could identify as neither, or as somewhere in between. "I went with the lesser of two evils and decided to portray myself as a man," said Brooks, who had been struggling with a conflict between a person's gender assigned at birth and the gender with which they identify. "I didn't want to re-educate them on the correct terminology," Brooks added. "I just wanted to get out of there." Brooks, who was assigned female at birth and uses they/them pronouns, was eventually put on a list of female patients by the nursing staff and repeatedly referred to as a girl. "General health care, physical or mental, I'm even more uncomfortable with due to the likelihood of being misgendered and experiencing miseducation as a patient," said Brooks, who now relies on backlogged LGBTQ clinics for services. Citing federal patient privacy laws, Todd Dixon, a spokesperson for Aspire Health Partners, said he could not comment on Brooks's claims. A recent in the journal LGBT Health found Brooks's experience is not uncommon among non-binary patients. The report, conducted by researchers at San Francisco State University and Columbia University, found nearly all non-binary participants surveyed reported encountering health care providers who did not provide gender-affirming or inclusive care. Participants felt that providers, even those with training in transgender care, lacked the knowledge, training and experience to provide them with the health care they need, the report's authors, James E. Likens and Ellen J. LeBlanc of SFSU and Walter O. Bochting of Columbia, concluded. Genderqueer and non-binary young adults in our study often felt misunderstood, disrespected and frustrated as they sought and received health care. The study's findings did not come as a surprise to an assistant professor of psychiatry at Harvard Medical School and director of the Fenway Institute's National LGBT Health Education Center. Kiroglian said most doctors are not educated about non-binary gender identities. Clinicians have not been trained across the board to know how to use correct names and non-binary pronouns, he said. It's a critical part of affirming the patient and having them remain engaged in care. Otherwise, people will not go back to see their clinician. A healthcare provider who is not educated about or supportive of the patient's gender identity can compound a non-binary patient's trauma, Kiroglian said. There is a chronic victimization that is unfortunately perpetuated in healthcare, which should be a refuge for everyone to access care, Kiroglian said. When that doesn't happen, there is re-traumatization and people continue to experience minority stress. This can be a source of anxiety and depression, which can lead to adverse health outcomes. Mishi Killian, who is 26, gender nonconforming and uses male pronouns, said he was told at a doctor's office that he was not trans enough for hormone replacement therapy. It ruined all the plans that I had, said the Kentucky native, who spent months retrieving gender affirmation documents for hormones and surgery. It sent me into a deep depression and messed up my dysphoria that was under control. Killian, who presents as androgynous, said doctors urged him to consult more therapists to confirm a diagnosis of gender dysphoria. Now, I wonder every time I go to the doctor if they are going to say the same thing to me again, added Killian, who said he sobbed in the exam room as doctors denied his eligibility for hormone treatment. I already don't like doctors in the first place, but it put a bad taste in my mouth and made me trust doctors even less. Violette Sky, 42, an activist in Salem, Oregon, who was born intersex and identifies as gender non-binary, said doctors forced them to go on testosterone. Most doctors operate within the binary and only see people as either male or female, said Sky, an advisory committee member for the Intersex and Genderqueer Recognition Project, a non-binary advocacy group in Fremont, California. My body rejected testosterone for the decades that I was on it. Elliot Butry, 17, said a therapist 3 years ago laughed and said non-binary gender identity did not exist, dismissing it as a phase. Butry dropped the therapist. It hurts that people constantly question who you are, said Butry, who lives in Michigan. After that painful visit, Butry wondered what it would be like to be a normal teenager. If my therapist says I'm not real, maybe I'm not real, Butry recalled thinking at the time. Individuals who identify as non-binary or genderqueer, Another term used to describe those who identify as neither exclusively male nor female, are a substantial and growing subgroup of the gender-nonconforming community, according to Likens, LeBlanc, and Bochting. In a 2017 survey published by the LGBTQ media advocacy group GLAAD, 12% of respondents between 18 and 34 identified with a gender identity other than the one they were assigned at birth. 3% of those surveyed identified as agender, 3% as gender fluid, 2% as transgender, 2% as unsure/questioning, 1% as bigender, and 1% as genderqueer. While the specific term non-binary was not one of the options, a number of the other terms would fall under the non-binary umbrella. Several states across the country are now recognizing. New York City last month became the 5th place in the U.S. to offer non-binary, also called gender-neutral or third gender, birth certificates, following California, Oregon, Washington State and New Jersey. 3 states and Washington, D.C., allow non-binary driver licenses. A number of healthcare professionals, researchers and non-binary patients say the medical community must make changes to address this growing group as well. In their report, Likens, LeBlanc and Bochting recommended that health forms be inclusive and affirmative of a range of gender identities and expressions, that providers receive more training in order to establish a higher level of gender literacy and competence to better serve non-binary patients, and that providers avoid assumptions about patients' gender identity and ask open-ended questions to encourage them to relate their unique experiences of identity and health. Kiroglian, who 2 years ago started a program at Harvard Medical School to teach doctors in training about caring for transgender and non-binary patients, recently launched a specifically aimed at helping doctors communicate with non-binary patients. Best practices for all healthcare staff include avoiding assumptions about patients' gender identities, asking for information about name and pronouns in order to adopt these consistently throughout the clinical setting, and describing anatomy and related terms with gender-inclusive language, Kiroglian and his co-authors wrote in the guide's conclusion. Brooks said they hope doctors and other healthcare providers can foster a safe space for non-binary patients. People should have something that is reliable, not something that will make them feel worse, Brooks said. Tatiana Bellamy Walker is a freelance journalist covering LGBTQ politics. She is also a Knight Fellow and Master's candidate at the Craig Newmark School of Journalism.